Psychologists work with organizations to apply findings from psychological research to improve the health and well-being of employees. Some work as external consultants hired by organizations to solve specific problems, whereas others are full-time employees of the organization. Applications include conducting surveys to identify issues and designing interventions to make work healthier. Some of the specific health areas include accidents and injuries. A major contribution is the concept of safety climate, which is employee-shared perceptions of the behaviors that are encouraged, e.g., wearing safety gear, and discouraged, not following safety rules. At work, organizations with strong safety climates have fewer work accidents and injuries. Cardiovascular disease. Cardiovascular disease has been related to lack of job control. Mental health. Exposure to occupational stress is associated with mental health disorder. Musculoskeletal disorder. These are injuries in bones, nerves and tendons due to overexertion and repetitive strain. They have been linked to job satisfaction and workplace stress. Physical health symptoms. Occupational stress has been linked to physical symptoms such as digestive distress and headache. Workplace violence. Violence prevention climate is related to being physically assaulted and psychologically mistreated. At work, interventions that improve climates are a way to address accidents and violence. Interventions that reduce stress at work or provide employees with tools to better manage it can help in areas where stress is an important component. Industrial psychology became interested in worker fatigue during World War I, when government ministers in Britain were concerned about the impact of fatigue on workers in munitions factories but not other types of factories. In the UK, some interest in worker well-being emerged with the efforts of Charles Samuel Myers and his National Institute of Industrial Psychology, NIIP, during the interwar years. In the U.S., during the mid-20th century, industrial psychologist Arthur Kornhauser pioneered the study of occupational mental health, linking industrial working conditions to mental health as well as the spillover of an unsatisfying job into a worker's personal life. Zicker accumulated evidence to show that no other industrial psychologist of his era was as devoted to advocating management and labor practices that would improve the lives of working people. Quote,